Howdy everybody, my name is Ryan Jackson and today I'm going to be doing my case presentation on the psychology and film assignment on Tony Stark from Iron Man 3. I will be analyzing Tony using the DSM-5 criteria for psychological disorders, and I'll be focusing specifically on post-traumatic stress disorder or PTSD. So I'll walk through his background, the cultural context of the film, the diagnosis, evidence from the movie, treatment recommendations, and how the film just shapes our understanding of mental health. Tony Stark, who is Tony Stark? He's a billionaire engineer and superhero who is dealing with the aftermath of the Battle of New York from the first Avengers movie. In Iron Man 3, you can see him clearly struggling. He's anxious, he's restless, he's constantly on edge. And so this film setting matters because it takes place on a U.S. military tech culture where emotional toughness is just expected out of soldiers, and so especially for men in leadership roles like Tony as well. And Liddell and Jobson, in the study that I used to back this up, point out that Western individualistic cultures often encourage people to push through trauma rather than to openly express distress and process it in a healthy way. And that fits Tony perfectly. He tries to hide what he's going through and he pretends he's fine, even when he's clearly not. So that leads us to the diagnosis, and the diagnosis that I chose for Tony Stark is post-traumatic stress disorder, commonly known as PTSD. So according to the DSM-5, PTSD involves exposure to a traumatic event, which includes symptoms like intrusive memories, avoidance, negative mood changes, and hyperarousal. And so Tony definitely experienced trauma in the Battle of New York. He had a near-death experience, and he almost died fighting aliens. So he meets this criteria absolutely perfectly. And in the cultural context of the film, if Tony walked into a therapist's office in the US, he would almost certainly be diagnosed with PTSD just because his symptoms are very obvious and apparent. But across cultures, and looking at cross-cultural considerations, PTSD isn't always recognized the same way. Jacka Wickream and other authors in a 2022 study found that PTSD symptoms vary across countries. And some cultures don't emphasize avoidance or intrusive memories the way Western cultures like the United States do. And Meyer and other authors from 2022, they also showed that people's beliefs about what causes PTSD differ depending on cultural values and gender norms. So in another cultural context, Tony's symptoms might be interpreted as stress, spiritual imbalance, or even a heroic burden rather than an actual disorder like it would be in the United States. In the US, though, PTSD still carries stigma, especially for men. It's often associated with weakness or instability, and that stigma is definitely a part of why Tony tries to hide his symptoms. Evidence for diagnosis, Tony shows multiple DSM-consistent symptoms. The first major symptom is his intrusive flashbacks. He has panic attacks whenever someone mentions New York or aliens, and these moments show intense psychological distress, which lines up with DSM-5 intrusive criteria. Varma and some other authors from 2024 also found that intrusive memories are one of the strongest predictors of PTSD-like symptoms and overall impairment, which fits Tony's experience really well. The second symptom is hyperarousal. Tony, he can't sleep, he's irritable, and he's constantly on edge, and he even jumps at sudden noises throughout the movie. And so research by study in 2025 by authors Brzodowska and Grabowski explains that hyperarousal is linked to neurobiological changes like heightened adrenergic activity and HP axis disruption. So basically, the brain gets stuck in a fight or flight scenario, and Tony's behavior matches that to a T. And a symptom he doesn't show, though, is dissociative amnesia. There's no point in the film where he forgets any part of the trauma or loses memory of it. And that 2025 study with Grabowski also notes that this dissociation tends to follow different neurobiological pathways, and Tony doesn't show these signs. So overall, the symptoms that he does show, they're well supported both by DSM-5 and also empirical research that I was able to find. Slide 5, going into our treatment plan. So for treatment, the best fit would definitely be trauma-focused cognitive behavioral therapy, or TFCBT, and prolonged exposure therapy, which is PE. So both are first-line treatments for PTSD. Brzozowska and Grabowski in that 2025 study also explained that these therapies help reduce intrusive memories and hyperarousal by targeting the underlying fear networks in the brain. And there are ethical considerations, of course. A therapist would need to be careful not to re-traumatize Tony during exposure-based work because they would be reliving those memories. And confidentiality would also be a huge issue just because he's a public figure and a celebrity in the movie. And so, of course, Tony also would have to be willing to participate because autonomy is definitely important. Autonomy is important. There are also barriers to this treatment. Stigma is a big one. Not wanting to be seen as weak in the public eye for Tony Stark in this movie would be big. And Meyer and other authors from the 2022 study also found that cultural beliefs about trauma strongly influence whether people seek help or not. Tony's lifestyle, constant danger, and distrust of professionals who make treatment harder. He's also someone who just prefers to solve problems alone, which is common with people in powerful, celebrity, high-status roles. Broader perspectives, so just how accurate is the film? Honestly, Iron Man 3 does a better job than most superhero movies in portraying the mental side of being a hero. Tony's panic attacks, his avoidance, and his hyperarousal are portrayed very realistically, but the movie oversimplifies his recovery, to be honest. He gets better pretty quickly once he finds a purpose in the movie, which doesn't necessarily match what research has shown. The Liddell and Jobson 2016 study explains that PTSD symptoms are maintained by disrupted fear regulation and attentional biases, which usually take lots more time and structured treatment to address. Media portrayals like this shape how we think about PTSD as well. Meyer, a study from 2022, showed that cultural beliefs influence how people interpret symptoms, and movies play a big role in shaping those beliefs. So in another cultural context, Tony might not even be seen as having a disorder. He actually might just be viewed as stressed or spiritually unbalanced, which is something that we've talked about before. So overall, my works cited with my sources, but overall, Tony Stark definitely meets DSM-5 criteria for PTSD, and the research strongly supports that diagnosis. The film does get a lot right, but it also simplifies recovery in a way that doesn't necessarily match real-world evidence. But that's my diagnosis on Tony Stark from Iron Man 3. It was a great movie to watch. It's one of my favorites, and I enjoyed this project. Thanks for listening.